Cool, guys. So, good evening, everyone, and I welcome you all to this wonderful program. What we are starting today. Yeah. So we are starting this today. Well, let me open this. Yeah. I hope now I'm audible and visible, guys. Okay. Yes. So let's start. So, guys, I welcome you all to this wonderful program. What we are starting today. This is a 4 days program. Okay, this is a 4 days program. As you can, uh, you might have seen in the browser. Let me share the browser and tell you a bit about this program. Then we can start about the class. I mean, start the class, right? Okay, so this is the browser. Yep, this is the browser. So yeah. So guys, we have come up with another 4 days short-term skill development course, and that course is a very hot topic. If I say, for the people who are in the pharmacy background, majorly the PharmD and in the pharmacy practice, pharmacovigilance, and regulatory affairs, because this topic is applicable everywhere in the pharmacy, and the topic is nothing but drug utilization evaluation and drug utilization review. So see, traditionally, you might have been studying this topic in your syllabus. It's there in your all the syllabuses in your B Farm syllabus, in your PharmD syllabus, and this is one of the important topic as well for your academic purposes to get some marks and to pass the exams. And this is like if I say, this is the basic and fundamental of your pharmacy practice. This is the fundamental of pharmacy practice: drug utilization evaluation, right? Drug utilization review. You all have gone through the theory part in your syllabus, I believe. But this course, how I made is to define this completely differently, different from all the theoretical aspects and all the basic aspects, right? All the basic aspects. So we will cover those basic aspects for the people who are new to this course, and we will cover a little bit basics of the theory and history and everything. But along with that, my complete focus, at least 3 days and 4 days, will be on the applications of DUR and DUE in modern clinical and research settings, because that is what you must learn. That is what you must understand, like how you can utilize DUE and DUR in the modern clinical and research settings, because this is the fundamental. As I told you, this is the basics of pharmacy practice, and based on that you can do any kind of research. Recently we have completed the epidemiology and public health course. That was another important part. But if we just look separately and shift from that part, from the epidemiology to the clinical part, or to the clinical part, or to the pharmacy practice part, or to the clinical pharmacy part, we will see that there is a very high scope of drug utilization evaluation and studies relevant to drug utilization evaluation or drug utilization review, right? So we can establish, we can plan almost 10 to 15 type of studies, and in multiple domains, at drug utilization evaluation and drug utilization review. So based on that, only based on my research experiences only, I created this course for all of you. That is drug utilization review, right? And this is a 4 days course. I'll not go into this about the course and objectives, but definitely I'll tell you this course will be very, very important, because after this course I'm very sure that you will be having the clear concepts. You will be having the clear concepts of making the research studies over DUR topic. Okay. And you will also have the entire process of designing and executing the DUE or DUR projects, or the studies for your either PhDs, for your PharmDs, for your master's projects. So based on that, you can create, you can prepare your own protocols. You can you can come up with your own topics. Okay, you can come up with your own topics. I'll give you multiple domains where you can just you just have to click, and you just have to go for the topic of research, right? And definitely you will be having other type of knowledges, also other type of what we say, the strategic improvements in your learnings, right? So syllabus, this is a comprehensive syllabus, and 4 days I'm trying to cover the entire utilization, drug utilization, DUE and DUR. So as you can see here, we are covering the definitions, historical perspectives, ethical and regulatory considerations, key stakeholders and their roles in that. So this is the basic histological part, basic introductory part. But after that, I'll be shifting from tomorrow completely to the methodologies and tools. I mean, though I think there's no class tomorrow, but I mean, day after tomorrow, in next 5 days we will complete the 4 days. So then we'll be shifting completely to the methodologies and tools, how to conduct the DU and DUR, and how we can plan the research out of it. Okay, so in that there are multiple things like all the steps of conducting a DUR and DUE studies, and then data sources, correction technique, statistical methods, and their interpretations, how to go for it. And then we'll be talking about applications and implementations. Okay. And then last day, I will be talking about the modernization of DUR. So I'll be talking completely on AI and ML models, digital tools, what you can use in DUE and DUR to conduct the studies, or to make the DUR efficient according to the current era, right? So this will be the coverage in next 4 days. And guys, the certificate, absolutely you have to attend all the classes, absolutely all the classes. Okay, there will be feedback forms in all the classes. Feedback form means attendance form in all the classes, and along with that, at the end of the course you will have a test. Okay, you will have a test for 20 minutes and 20 questions, multiple choice questions, and you have to clear that test, right? So before 31st, I mean, by the 31st, we have to complete this course. By the 31st, we have to complete this course. So this is actually the 4 classes course. Okay. And let me tell you a bit about myself, as I'm going to take this class. So you should know what, I'm going to do and what I have done in this field, and, why I'm taking these classes. See, I have done my PhD in cardiology and heart failure, especially. I have done my PhD in heart failure, and that PhD had the major 3 objectives. Okay, so overall, the PhD was a registry study. My PhD was completely the registry study, and I have conducted India's one of the largest registry study in heart failure. Okay, so as I told you in last class, I had around 580 plus objectives in my PhD, and out of that, I had 3 objectives. I mean, 581 variables, and I had 3 objectives majorly, right? So first objective was to find out the prevalence and incidences of heart failure, relative risk factors, and assessment of the risk factors and all. And the second objective of my PhD was drug utilization evaluation and drug utilization review for heart failure. That's why I'm conducting this course, because this is one of the best thing you can do without using multiple funds, without using multiple resources, and you can conduct such studies at a very low cost and with the great impact on society, right? So that's why I prepared this course for all of you, so you can also plan something like this. Okay, and based on my PhD objectives only, I took the last class, the last course on epidemiology and public health, and this is on health resource utilization. In the drug utilization evaluation and drug utilization review. And then my third objective was health resource utilization and health related quality of life of heart failure patients, right? So this is my background, and I have worked almost on 2.5 crore grants from various societies, ICMR, DST, and multiple international societies like European Society of Cardiology and American College of Cardiology, and multiple fellowships I did on the research only. Recently, I did my fellowship in heart failure registry studies and heart failure clinical trials, updated version of the clinical trials, whatever the upgradations are there, especially in the cardiovascular disease. I did that course from Italy recently, and I have published almost 60 papers as a first author or corresponding author in the domain of medicine, I'll say, because during my PG and during my PhD, different domains were there. So my major papers are on the heart failure and then infectious diseases, right? And now I'm working in the field of ICMR. I mean, working in the field of diabetes for ICMR, right? So I'm working as scientist C for Indian Council of Medical Research for last 4 years. This is my fourth year going on as a scientist C in ICMR, and my working domain right now, my working interest right now is diabetes, right? But major background thing is registry studies, drug utilization evaluation, and healthcare resource utilizations. Okay, that is my major domain, basically in the field of research, right? So with that, I'm holding multiple other positions, but I'll not go into that. So I hope you will get a lot of new things from my experience, and I'm going to tell all my experiences what I have faced while I was doing the drug utilization evaluation. And last day, I mean the fourth day of this course, I'll be telling you the major results of my studies also, and where it has been published, right? And how I have presented, because I have presented my studies, my this PhD study, and multiple objectives and multiple things in almost 15 international and symposiums. And I have visited almost 15 countries, 16 countries out. Getting a lot of new things. I'm very sure that you are going to get a lot of new things, but please stay with us. Voice getting break. Is it fine now? Or maybe some network issues. I'm not sure who's, it might be. Okay. So whenever it is stuck, please let me know. Please write in the chat box, or you can speak also. I did not keep everyone on silent. So guys, you can talk also. Okay, no problem. So, and definitely I'll be, using my easy going formula for teaching. So that will be based on the questions. That will be based on the questions, and then I will be coming to the structural teaching part. So let's start with the questions, guys. Okay, and I want every one of you to participate in the questions. I want every one of you to participate in the questions. Okay, so let's start, guys. I'm just starting. So yeah. So this session has no conflict of interest. I have no conflict of interest because all the PPTs have been prepared only for the educational purpose, not for any practice purposes. So in this series, we are going to discuss in the four modules I have discussed. Like first is introduction to drug utilization evaluation and review, and then second will be methodologies and tools, and the third day will be talking about applications and implementations and use of technology in DUE and DUR. So the classes will be, let me tell you, the classes will be uh, today, not tomorrow. Tomorrow I have my exam. Then I'll be taking one class on mostly Sunday. Tomorrow and after tomorrow, I may not take the class because I have, my exam. My MBA exams are going on right now. So I'm doing corresponding MBA. So my MBA exams are going on. So tomorrow I'll not take. Day after tomorrow, I may or may not take. I'll inform you. And then Sunday, Monday, Tuesday. Sunday, Monday, Tuesday, I'll take 3 days. Okay, and we'll finish by Tuesday. Most probably, we'll finish by Tuesday. I hope I don't have the exam on Tuesday, so I'll be finishing by Tuesday this course. Okay, and if I got time, definitely I'll take on Saturday also. Right? Tomorrow, no exam. I mean, tomorrow, no class. So let's start without delaying because it's already 7:20. So guys, today let's start with some questions. That is our tradition of my classes. Let's start with some questions, right? Okay, guys. So let me, yeah. So your first question, what is the primary goal of drug utilization evaluation? Yes, everyone. What is the primary goal of drug utilization evaluation? Yes, please tell me. Yes, everyone. I'm looking for the answers fast, fast. B, 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 B. Okay. Perfectly fine. So, guys, now let's analyze all the answers. Let's analyze all the answers. So, first of all, what is DUE? Let's understand the term DUE, drug utilization evaluation. Ajit, I will ask you one more question right now, guys. DUE and DUR. There are two terms, right? Drug utilization evaluation and drug utilization review. Drug utilization evaluation and drug utilization review. Are these two terms different or same? My question to all of you is, are these two terms separate or different? I mean, separate or same? Different. Okay. How? You have to tell me how also. Same, different, same, different. Okay. Yes, guys, please tell me. Different, different. Whoever is telling different, you have to give me the answer why DUE and DUR are different. Yes, guys. Yes. Same or different? Please, guys, fast. Different. Tell me answer why. Why these are two different terms, DUE and DUR. Drug utilization evaluation and drug utilization review. Okay, so let me tell you, these two are completely different terms. I'm going to discuss in my upcoming slides. Definitely, DUE and DUR are completely different terms. Their scope, their objective, their definition are completely different. Okay, completely different. But let me tell you one important thing here. Let me tell you one important thing here. The outcome of DUE and DUR are same. Okay, drug utilization. Drug utilization, assessment of drug utilization. Okay, the outcome is similar. Assessment of drug utilization. Assessment of drug utilization, right? This is the outcome, but why these are different? First difference I will tell you here, and then we will discuss in upcoming slides. So DUE is conducted or being done at individual level. Okay, individual patient level, individual level. Okay, and DUR is at community or population level. Community, population, group of population at population level. Okay, this is the first thing you should understand, the difference between DUE and DUR. Drug utilization review is a wide, vast term. Drug utilization review is a vast term that is being done usually for the public, usually for the big number of people, usually for the group of people, population, community, right? And when we are targeting the community, when we are targeting the big number of people, definitely our objectives will be different, our scope will be different, right? Our objectives will be different, our scope will be different. And when we are looking at the basic level, when we are looking at the basic individual level, like each patients we are focusing on, then our objectives and scope will be different, that I'm going to discuss in the further slides, next slides, right? So the basic difference you have to understand is DUE is at individual level, DUR is at big level, at the population level, right? So let me come back to the answer here. Let me come back to the answer here. The primary goal of drug utilization, see, first thing is to increase the cost of medication therapy. This is not a thing related to drug utilization evaluation. Drug utilization evaluation may tell you that your drug is not performing well in the usually in the society or in the patients, your drug needs to need the improvement, but still they don't talk about the pricing of the drug. Okay, cost of the medication therapy is one thing which comes under the healthcare resource utilization, okay, or economic burden of the disease. Focus on the terms what I'm talking. Okay, focus on the terms what. I'm so sorry, guys. Yeah. So the drug cost is nothing but the disease burden or healthcare utilization. Healthcare utilization, right? Healthcare utilization. So in that, what we exactly work on? We work on the cost analysis, cost benefit analysis, and all that we have talked in the last course. But here DUR or DUE, anything, these both can correlate, focus, can correlate with the burden, with the disease burden, or with the cost assessment, but it will not participate in costing. Understand? It will not participate in costing. That can just be helping the researchers, because when they are working on the drug utilization review, when they're working on the drug utilization means they can also find out the cost of the disease, cost of the medicines. Okay, but it will not help the researchers to get the cost burden or anything of the disease. Okay, and that will not help the researchers to find out, to get into the costing of the drug. Okay, costing of the medication therapy, because costing of the medication therapy is not reason behind. Okay, let's understand the reason behind. Because when we talk about the cost of medication therapy, it is not only the drugs or syrups or injections or other things. That also include the travel cost, the daily cost of living, daily cost of living, and the food cost, and the accommodation cost, or the hospitalization cost, or the registration cost, or multiple things. Costing is not just the therapy. Costing is the resources which have been used, and the time costing is also there. Whatever is, like the person or the person's attendee spent in the hospital or in the care center, right? So everything is being included in the costing. So definitely DUE or DUR, which are directly related to the drug utilization, are not directly involved in costing of medication therapy. Okay, costing of medication therapy has a wide term, and that completely associates with costing. And that costing, when I'm talking costing is a wider term which includes therapy, doctors expenses, visits, and admission, registration, and consultation charges, traveling, food, daily allowances, everything. Okay, that include everything. So this A option is not in the scenario, right? And then let's look at the third. As you all are telling, this is the B, right? So let's assume B is the correct answer. So let's assess the third, the third answer. See, to ensure patients always take generic medications, this is a policy. Okay, this could be a policy. This is not a policy. This could be a policy, but that is again not a part of drug utilization review. That is not a part of this, drug utilization review. This is a part of decision making. This is a part of decision making, and that also, guys, focus. That also cannot be done by the pharmacist or by the doctor or any healthcare professional. This decision making can be done only on the basis of finances and all by the patient. Remember, generic medications, taking generic medications or not taking generic medications, that is 100% decision of the patient. Doctor or pharmacist can just suggest, but they cannot, they cannot participate in the decision making of the patient to take what kind of medicine they want to. Okay, and then to eliminate the need of pharmacist involvement, definitely not, because DUE or DUR is for the pharmacist, by the pharmacist, from the pharmacist. Okay, DUR is being done by the pharmacist, created by the pharmacist, and they are the primary stakeholder in DUE or DUR studies, right? So definitely not at all. So these three answers are wrong, right? So correct answer is to identify and improve the inappropriate drug use. Why we do the drug utilization review or drug utilization assessment or evaluation? Because we want to know if the drugs are being prescribed, dispensed, or being taken in the correct manner. Understand, guys, focus. If the drugs are being prescribed, dispensed, or being taken in the correct manner, right? So this includes multiple stakeholders again, right? Like based on their role and responsibilities. I'll come to that later. So definitely the answer here is to identify and improve the inappropriate drug use at what level, by whoever. So it includes the improvement of inappropriate drug use, right? Now, answer here is to increase the improve inappropriate drug use, right? Next question. Next question to all of you is, which of the following is a key step in conducting the DUR? Which of the following is a key step? Is a key step in, yes, guys, is a key step. Yes, guys, looking for the answer. Yes, guys, 13. Okay. B and C. Why C and why B? Yes, guys. C. Why B? Why B or C? Yes, finding a threshold of the drug is important. Okay. Many people are writing B. Okay, let me see. Let me discuss all the answers. Which of the following is a key step in conducting a DUR? All are the steps. Do you think all are the steps? No. Reducing patient visits is the outcome. First of all, reducing patient's visit or patient visits is the outcome of DUR. Outcome of DUE or DUR. Okay. And then prescribing new medications is not a task of DUR. Not at all. This is the task of doctor. Okay. This is the task of the doctor, right? Conducting a random survey. Conducting a random survey is a part of DUR, but that is not the key step because it comes under the data collection. It comes under the data collection. Okay. And there are multiple methods for data collection. Okay. There are multiple methods for data collection when we are conducting the DUE or DUR studies. Okay. This is a step because when we talk about the methodology, there are multiple methodology. There are multiple methodology like the as you know the statistics, there are the simple studies, then simple statistics like you find the frequencies, percentage, and then there is inference statistics where where you look for what, where you look for the correlation and associations, and you apply the chi-square test, you apply the regression, you apply the survival analysis, you apply multiple things, the high end statistical tests, right? So there are multiple methods, so we cannot say that random survey is one of the, I mean, random survey is one of the method, but random survey is not a key establishment method. Okay, random survey is not a key establishment step or key step. So the answer is establishing the criteria and thresholds for evaluation. Establishing the criteria and thresholds for evaluation. What is thresholds for evaluation? Like at what extent you want the evaluation, at what extent and with what objectives, and under what we say that up to which depth you want to do the analysis, okay, of the drug utilization, like the frequencies, correct doses form, or maybe the correct dose, or risk benefit ratio, or maybe the drug interaction, side effects, multiple things are there. Okay, multiple cost effective analysis, you can do multiple things in this, you can do multiple things in, so you have to decide the criteria, like which criteria you want to choose and what kind of threshold you want to conduct or you want to keep to conduct a DUR study. Okay, so the answer is C, establishing criteria. Then the next question to all of you is, which stakeholder is typically responsible for performing DUR in a healthcare setting? I'll skip this because you all know. pharmacist. You all know this is the pharmacist who perform the DUR. No one else can perform the DUR, neither patient, neither insurance companies, because these are third parties. And then nurses also cannot do the DUR. Nurses are also not expert of DUR. Nursing are also not trained to conduct the DUR. Okay, nurses are not trained to do the DUR. They can do. Okay, they are not like, it's not like that they cannot do. They can do the DUR studies, but they are not uh, trained to conduct the DUR studies. So because they don't have the medication knowledge as well, but the best part here is pharmacists can do, and pharmacists are responsible to perform the DUR studies. Okay. So answer is this. Now, next question to all of you. Which of the following is not a type of DUE or DUR? Yes, guys, typical question, a little toughness, little toughness. Yes, which one? D. Wow, my audience is amazing. Yes, my audience is really tough. Wow, D, absolutely. Okay, so guys, see, now, if you have just told me this, you are perfectly correct. You are perfectly correct that there is nothing like predictive DUE or predictive DUR. There is nothing like predictive DUE or predictive DUR. See, this is a basic class. So that's why I'm telling you the basics. And I'm trying to cover everything. Okay. So when it is about the methods, right? Methods of conducting the DUR, there are three methods. One is prospective, one is retrospective, one is concurrent. Okay. So can someone tell me what is prospective? Yes, guys, tell me what is prospective, because these studies, I think we have even studies in my last course of epidemiology and public health. Tell me, guys, every one of you, please, help me finding what is prospective, what is retrospective, and what is concurrent. Yes. Prospective is follow-up. Results are yet to occur. No, I'm asking in terms of DUE. In terms of DUR, what is prospective? What is retrospective? Prospective is follow-up. The results are yet to occur. Later part of the study is prospective. Past part is retrospective. I didn't understand this again. Prospective is forward-looking studies. Okay. I'm asking in aspect of DUR. Right. Okay. Prospective present studies. Okay. Forward looking. Okay. Anyone else? Yeah. Okay. So I think I should take a little time here. I should take a little time here to make you understand what exactly the things are. What exactly the things are. So see, first of all, guys, here we will take a little time. You have to understand this because this is very important. See, we are studying what? Drug utilization. Utilization, evaluation, right? Or review, focus, right? We are studying drug utilization, evaluation, or review. So definitely we are talking about assessment. Evaluation or review means assessment, right? Evaluation or review means the assessment. Okay. First thing is assessment of drug utilization, right? Assessment. Guys, focus here. I'm trying to explain it in the nice way. Review. Okay. Evaluation or review of the drug utilization, right? Now there are three terms, there are three methodologies. One is prospective, as I described you. Prospective is in term of studies, in terms of epidemiological studies, is prospective means if you are recruiting the patient presently. Okay, if you are recruiting the patient presently, patient is present, and then you are collecting the data. Okay, and retrospective means you are recruiting the patient, but you are collecting the data in back dates. That is in terms of studies. But when it comes to the DUE or DUR, it is completely opposite. Okay, it is completely opposite in terms. Okay, in terms, it is completely opposite. So prospective and retrospective. Look at this. This is before dispensing. Prospective means before dispensing. I'll tell you, I'll explain it. Before dispensing, and this is after dispensing. Okay, this is after dispensing, and this is while administering the medicine. While administering or taking the medicine, administering the medicine, right? While taking the medicine or administering the medicine to patient. Now let me explain it so you can understand it easily. What does it mean by before dispensing? I'll give you an example now. See, a doctor, a doctor is seeing the patient XYZ, is seeing the patient XYZ, and what he does, he just write the 8 medications, 8 medications, and these medications are for multiple diseases. This patient has multiple problems. Okay, so it comes under the polypharmacy. Focus, guys, focus for the example. Polypharmacy, 8 medications. Polypharmacy, definitely, because he has 3 diseases: hypertension, diabetes, and rheumatoid arthritis. The patient has 3 disease. One is diabetes mellitus, one is hypertension, one is rheumatic arthritis. Okay, so the doctor has written 8 medications, and the prescription goes to pharmacist. Prescription goes to pharmacist. Okay, prescription goes to pharmacist. Guys, understand on the fundamentals, basics of DUR, because when I'm explaining the process of DUR, this all is going to come to you. Okay, this all you have to understand today, because it is going to help us in when we are constructing the process of DUR. When I'm explaining any studies, any example of the DUR studies, you have to understand this, like what was the deep what was in the deep of process, what was in the deep of process. This is the basic fundamental. Like, so first, the patient with multiple problems have come to the doctor. Doctor has written 8 medications, and when these 8 medication prescription goes to the pharmacist. Okay, if goes to the pharmacist look at this and he says, oh, there could be something, the interesting fact means the drug interaction could be there, drug interaction, because the research says more than 7 medications in a prescription, or more than 5 medications in a prescription, more than 5 medications in a prescription has 70 to 80% chances of drug interactions. Say more than 7 medications in the prescription has almost 100% chances of drug interaction. Mild, moderate, severe, doesn't matter, but it has almost 100% chances of drug interaction. More than 7 medications in a prescription has almost 100% chance of medication interactions, right? Drug interactions. So to check that, the pharmacist right now, before dispensing this to the patient, before dispensing all 8 medications to the patient, is a clinical pharmacist. So he does the entire prescription review. He does the entire prescription review. He do it for what? He do it for drug interactions, drug interactions. He do it for possible side effects, possible side impacts. He does it for food and drug impact, food or drug interaction. He does the entire thing. He does the check the entire prescription for multiple parts. I'll not go to the prescription audits, because prescription audits it includes from the doses forms to the correct spellings, or the correct frequencies, correct unit, and correct instructions and everything, right? I'll not go to the audit part right now. So the pharmacist at this point of time decide to audit the prescription, for possible drug-drug interaction, possible drug-drug interaction. And once he is sure, maybe there are multiple outcomes, like if he finds the drug-drug interaction, he will go back, or he will send the patient back, or he will talk to the doctor, the prescriber, and he will tell, sir, there is a problem in this, just in the prescription, there is a problem, right? You have to solve this. You write the replacement, or you write some other drug, or you cut down the frequency, or cut down the dose of the drug, whatever, like based on the entire situation of the patient right now, or whatever drugs he is taking, the pharmacist will introduce the intervention if he finds that there is something wrong. right? He will find the intervention. I mean, he will find the problem and he will, introduce the intervention, and that intervention will go to the doctor again, right? So this is the normal procedure, right? This is a normal procedure. Focus. Why this is? This is all happening before the medication is gone to the patient. Understand? This is all happening before the medication goes to the patient, before dispensing, right? This all process, drug utilization review, is happening before the drug is going to the patient, right? So this is not only the drug utilization review I was telling. I'm telling you the process. Otherwise, drug utilization review includes the risk benefit ratio. Drug utilization includes the, many things. Not only the risk benefit, I mean risk benefit ratio, but it includes the calculations, multiple calculations also, that I'll going to tell you. I'm going to tell you in the next classes. Definitely everything will cover, but you have to understand the process here, right? So when the things are happening before the dispensing, that is called as prospective DUR. Prospective DUR. Prospective DUR means it is happening before the dispensing. Okay. Unlike research studies, it is happening before, but not before, like before the patient's presence, or before the recruitment. No, it is happening during that part. It is happening into the research utilization review only, but happening before the medications are dispensed to the patient. Okay. Retrospective. Retrospective is suppose a patient, again patient XYZ, is admitted to the hospital. Okay. It is admitted to the hospital with a road accident. Okay. With a, road accident, RA, and he came to the hospital, and the doctor finds out that the patient also has high blood pressure. Patient also is taking some medications for depression. Okay. And patient also was taking some medication for gastritis. Okay, 3 medications he was taking, and today he met the accident. So he has to take maybe, sedatives right now, or maybe the painkillers, definitely, right? So there will be multiple medications. Now, what doctor has prescribed these medications, this prescription reached to the in-house pharmacy. Pharmacist will not give a sit here. Okay, in-house pharmacist will not give a sit here. He will not look into it, and he dispensed all the medications. All the medications reached the patient here. Okay, then the clinical pharmacist or someone there, like the doctor, suppose there will be multiple scenarios. The doctor will call the pharmacist. Okay, you come and please check what's wrong with this prescription, because this prescription looks like a mess. This prescription looks like a mess. There are multiple medications, multiple problems. Polypharmacy is there. So come and check. If the person, the pharmacist here, if the pharmacist is coming here and checking what exactly the problems are, if the person pharmacist is coming and evaluating this prescription after the dispensing of medications, that is called retrospective. That is called retrospective prescription evaluation. Understand? And then concurrent. Concurrent means when the patient is taking the medications or administrating. Let me tell you one more example here. I'm trying to, tell you the very basics of DUR. See, one patient, again, suppose XYZ has multiple medications. Suppose he has to take 3 tablets in the morning, 2 tablets in the afternoon, and 5 tablets in the evening. 5 tablets in the evening. Okay, 5 tablets in the evening. So what happens is the clinical pharmacist will be available in the morning time, and he is assessing all 3 tablets for what? For the same thing: side effects, risk benefit ratio, or how much should be the duration between all the tablets. Like this is happening concurrently when the patient is taking the things. Okay, SOAP notes are missed here. or maybe some other things he's telling. Okay, so guys, whenever the patient, yeah. So whenever the patient is taking the medication concurrently, okay, and their prescription or the medication taking is being evaluated or reviewed, that process is called concurrent thing. We will discuss that in details. Definitely we are going to discuss everything in detail, okay, in the upcoming classes. So this is like, you should understand what is prospective, what is retrospective, what is concurrent, right? And there is no predictive analysis before prescribing the medication. You cannot, do the, I mean, before prescribing means before prescribing, not dispensing. Before prescribing, you cannot predict any kind of DUR, because until and unless you don't know what medications have been prescribed, you won't say a word, or you won't be able to evaluate the prescription. Until and unless you don't have the prescription with you, you cannot do anything. So there is no room for predictions. Okay, there is no room for predictions before prescription, right? Bhagyalakshmi ji has one question. I have one doubt. So retrospective by itself, meaning is past and old. How can it be after study? See, that's what I was trying to, I got confused. Sometimes it is very, very confusing part. That's why I went back and checked myself, corrected myself. See, again, I'll repeat for you guys. I'll repeat for you. It's very confusing part. When I'm talking about retrospective, focus guys, again, retrospective epidemiological studies usually, or all the research studies, epidemiological research studies, research studies. Here, when we are talking about retrospective research studies, that means the data should be there from the past, past, before recruitment, before recruitment of the patient, or before recruitment of the participant into the study. Past or before recruitment, the data should be collected before recruitment, means not before the recruitment of the patient. A study must be done after recruitment only, but before recruitment means the date of the data will be taken from the past. Okay, it will be taken from the past or the before date, earlier date of the recruitment. Okay, earlier dates, earlier years of the recruitment, not before the recruitment. You cannot take the data before recruiting the participant into the study. The process of the study is, first you have to register the study, you have to take the IC, ethical approval, and then only you can start collecting the data. You can start recruiting the patient. When you have recruited the patient, but now the study bifurcate into two terms. At this point of time, the study bifurcate into the two terms, that is based on the data collection. If you are collecting the data from the past, that is called retrospective. If you are collecting the data from present or forward, like from the future, okay, in the future, not from the future, in the future, okay, that is called as prospective study. That is about the research studies. That is about the research studies. But here, when we are talking about DUE or DUR, here we are not talking about the study correctly. I'm not discussing about the research right now. I'm discussing about the fundamentals of DUE, fundamentals of evaluation. How we are doing the evaluation. If we are doing the evaluation before dispensing the medicine, that is called as prospective evaluation or prospective review. If we are evaluating after dispensing the medication which has already reached the patient, that is called as retrospective evaluation of the drug. Don't correlate with the study, research studies. In research studies, the term is different, and in evaluation, the term is different. Okay, so that's why even when I was not sure, I went back and checked it, right? So prospective in the study means definitely current and future, but in the evaluation it will be definitely before dispensing. So this is like, see, let me explain this guys, let me explain again for you, let me explain for you. See, suppose let me take this, right? See, there is a patient A, right? There is a patient A, there is a patient A. Now you have to understand this. This is a very fantastic thing I'm going to tell you. You have to understand this. See, the patient A. Okay, you are doing a prospective study. Understand the terms. Now understand in the term of evaluation and study, research studies. Understand this. Okay, so let me get a more page. Let me get some more space here. See, patient A, you are doing prospective study. Prospective study. Prospective study. Prospective study means you are collecting the data after recruitment. I mean, in the dates of after recruitment. For an example, this patient A has been admitted to the hospital on 28th of December 2024. Guys, understand, focus. 20th December of 2024, you are recruiting him today, or maybe on 24th, you are recruiting him. 12/20/24. Okay. And this study is DUR study. DUR or DUE. If you are doing it individually, DUE study. Evaluation. Okay. You are doing this evaluation. So this study is happening in the hospital. Prospective study happening in the hospital. You have, patient was admitted on 20 and you are recruiting from 24, or you're recruiting from the 20 only. You have recruited from the 24. Okay, so that means the patient presently is available in the hospital, or you have recruited him in present. So it is prospective study. It is prospective study, and now you will start collecting the data for future. I mean, in the future, right? Or I mean, in present and in future, you will be collecting the data for the study. Understand? Now, another part of this study. This study is drug evaluation, drug utilization evaluation. So how you can conduct this study? How you can conduct this study? First thing is because this is DUE, so you can evaluate his prescription, the patient prescription, immediately after prescribing. The doctor came into the ward, doctor prescribed the medication, and you are evaluating the prescription immediately before going to the pharmacist. Okay, before going to the pharmacist or before dispensing of the medication only, you are doing the evaluation. Understand? What is this called as? This is called as prospective DUE. This is called as prospective DUE. Okay, this could be a part of prospective study. Now, this another fact here is, if you are evaluating the same prescription after, I mean, you are not evaluating the prescription, you are evaluating the medicines when those are dispensed to the patient by the pharmacist. I mean, the doctor has written the prescription, it has gone to the pharmacist. Pharmacist has recommended the dispensed the medications has come to the patient, and now patient is taking. I mean, they have dispensed, I mean, it was dispensed and the medicines came to the doctor, I mean, came to the patient by the doctor, right? Or prescribed by the doctor and came to the patient right now from the pharmacist. If you are doing the evaluation right now, that is called as retrospective. That is called as retrospective. You will tell it is future because it is not before, it is after the prescription or after the dispensing. Why it is called retrospective? Why it is called retrospective is there is a reason. You have to understand that retrospective means whatever was supposed to happen. Okay, whatever was supposed to happen, this will, you have to go back and then do. See, in the prospective, you have to understand these two terms in form of evaluation here, in form of review here. See, prospective means before dispensing, and before dispensing, why it is called prospective? Because right now you can put the intervention immediately after the prescription, and that intervention could be corrected. Okay, that intervention, the feedback will go to the doctor and that will be corrected in the prescription. That's why it is called as present, at present, prospective drug evaluation. I'm not talking about the study. This is about the evaluation. Why that is called retrospective? After dispensing, why it is called retrospective? Simple method, simple formula, simple understanding, because whatever happened, whatever was supposed to happen, it has happened. Now you are taking You are correcting the mistake in the past. Understand? Understand this way. You are correcting the mistake or you are evaluating the mistake in the past or of the past. You are evaluating the mistake of the past after dispensing. Understand? That's why it is prospective and retrospective. That's why even the future actions are called retrospective here. That's why even the future actions are called retrospective, because if you want to correct it, if you want to evaluate the things, you are evaluating the things from the past. You are evaluating the things which should have been done before dispensing. Understand? So this is called retrospective. Why? That's why it is called retrospective. But the study is still, guys, listen, there is a beauty here. You have to understand it. But the study is still prospective. Whether you are doing the prescription evaluation presently or retrospectively. But the study is still prospective. Understand? Clear? Now, second thing, second scenario. The study is retrospective. Retrospective. Okay. And that means you are collecting the data from the past dates. Past dates. Right. From the past dates. So what will be the study type here? Retrospective study will only have one type of DUE, that is called as retrospective. There is no room for prospective evaluation. Keep in mind, there is no room for prospective drug evaluation in retrospective studies. Retrospective studies means only retrospective evaluation. You can evaluate those prescriptions, those drug prescriptions. But here, one more thing you have to understand. It is very, important thing to understand. First of all, the evaluation, guys, focus. The evaluation will be only retrospective because you are doing it after prescription, dispensing, after dispensing, even after administrating, because patient has taken and you are taking the data from the past. This happens in the past. So only retrospective, there is a room only for only for retrospective data review, only like DUE. Prospective cannot be done here. There is no room for prospective. It is only retrospective, right? The retrospective DUE can happen here. No room for prospective. First thing, retrospective studies can only be done by retrospective utilization review or utilization evaluation. Second thing is, very importantly, there is also no room for intervention and correction. There is also no room for intervention and correction in the prescriptions or in the dispensing or anything. You cannot go back like when the patient was admitted in March, you can just assess, you can just evaluate the prescription, but you cannot go back and put the intervention and correct that prescription. You cannot. Understand? You cannot. So that is the major difference. And I think you understand now what is prospective and what is retrospective, what is study and what is evaluation. Understood? So in the retrospective studies, you can do only retrospective drug utilization evaluation or drug utilization review, but you cannot put the interventions or you cannot do the corrections at all. And there is no room for prospective drug utilization. In the other hand, prospective studies can be done if you are doing the drug utilization, it can be done prospectively and retrospectively, both in prospective studies, prospective research studies. Understand the difference, guys? Understand? If understand, say yes. If any questions, please ask. I hope now you understood. Yes, guys. Any questions now? Clear? Please, everyone. Please, everyone, tell me. Is it clear now? Bhagya Lakshmi has the question. Is it clear? Okay, great. Thank you very much, guys. So now next question. I think next questions are already, we have discussed already. What is the main purpose of a prospective DUR? To evaluate the drug therapy before medication is dispensed. Okay, past medications, no. Identifying historical trends, no. Cost of medications, no. Right? Then this is the answer to evaluate the drug therapy before medication is dispensed. Then prospective is done. Retrospective. What is retrospective? To evaluate the prescribing practices after medication has been dispensed. Okay, this we have discussed. And concurrent. I mean, this is the concurrent. So what type of DUR occurs in real time? Concurrent is the real time DUR. Concurrent is the real time DUR, which happens when the medication is being administered. When the medication is being administered to the patient, right? Uh, that is called concurrent, right? That is called concurrent, correct? And okay, this is the answer. When it is there, we will describe this in sometimes. Now, next question to all of you. Yes. Which data source is not typically used in drug utilization review? Yes, guys. Yes, people. C. Social media posts, definitely. Yes. Yes, 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 it's absolutely yes. So now let me tell you. Now let me tell you. This is a very fantastic slide for the data collection. There is a method. I mean, this is one of the step in the DUR methodology, data collection, data sources from where you can collect the data for drug utilization review. First of all, medical records of the patient, medical records of the patient, definitely. Then history of the patient, then lab investigations. I mean, from any lab, if you have the data from the labs or, investigating, laboratories or histopathological laboratories or anywhere, right? And then you can also collect the data to evaluate. It is about the evaluation. So you need the comparison also. I'll come to that in the next class. I mean, you need to compare also. So you can collect the data from other resources also. Okay. And now let's come to the data sources what given here. Electronic health record is a direct source, is a direct source of data collection. So electronic health records will have the record of your, I mean, the patient's health conditions. It will have the data on the medications prescribed. It will have the data on the instructions, units, whatever you need. Okay. So electronic health record is the direct record or the direct source. Okay. Direct source for the DUR or DUE. Okay. Then clinical guidelines. Clinical guidelines will help you again. See, can someone tell me why and how the clinical guidelines will help you in DUR or DUE? And then the insurance claim. Let me tell you the insurance claims. Insurance claims will also have the details of all the procedures and medications and days in the hospital or conditions. Okay. Insurance claims will also have all the data on, the drug utilization, medical, how many days the patient was in hospital and what was the medical condition, what was the treatment, what was the resources utilization, everything, what was the procedures done, everything. So insurance claims also can be a data source. But now my question to all of you is how the clinical guidelines are being used. Social media post is definitely correct answer here because this is not a data source. You cannot collect the data from social media posts. Okay. So, but now my question is here for all of you, what is the clinical guidelines? I mean, how the clinical guidelines participate in DUE or DUR? Yes, guys. Can someone tell me? Yes, people. Tell me. Yes. Guys, help me why and how clinical guidelines help in DUR and DUE. Why these are the major data sources. I'm telling major data sources for DUE or DUR. See, yeah, guys, come on. The first agenda, first objective, what we have seen in the first slide was appropriate appropriate use of medications. And who will tell the appropriate guidelines? Guidelines and Evidence-based medicine, evidences. So what are the evidences? Guidelines. Guidelines are made on the evidences. Okay, guidelines are made on evidences. Simple. It is a simple funda. Drug utilization evaluation or drug utilization review is being done for appropriateness, to check if the drugs have been used or are being used appropriately or not. Understand? If they are being used appropriately or not. And if they are not being appropriately used, then you have to find out why. Right? So appropriateness, from where you will get the reference of appropriateness. Reference of appropriateness is nothing but clinical guidelines. Clinical guidelines. Clinical guidelines will tell you the appropriate therapy. Okay, that's how the clinical guidelines are the standards, and those are the major source for DUE resources. Understand? So that's how the clinical guidelines work. We'll tell in the later part also. Thanks. Okay, clinical guidelines. I mean, social media post was the correct answer, right? Okay, now one more question here. Not out of the box, definitely it is the process of DUE. Which of the following tools can be used for patient medication adherence monitoring? Social media apps, televisions, paper calendar, or smart pill bottles? Yes, people, fast. A. Now, my question to all of you is, what is a small pill bottle? Is it a bottle or is it a box or what? What is a small pill bottle? Sorry, smart pill bottle. Inserting a microchip. Okay. Is it? In bottle to monitor. Inserting a microchip in the entire bottle. Okay, let me understand, Arpita. You might be right. See, you are telling that there is a bottle. There is a bottle. See, guys, that's why I've taken this question up. See, this is a bottle, suppose, for thyroxine. Thyroxine, 50 mcg, and there are 50 tablets in one bottle. You are telling that there are 50 bottles in, I mean, 50 tablets in one bottle, and this bottle will have a chip somewhere, and it will tell about the uses of pills. You mean that? You mean that? And SS, I don't know who is SS, but telling reminds you to take medications. Okay, maybe the chip and the reminder in your mobile. Okay. Analyze number of pill in bottle. Great. Asna Jaiba. Okay. Mohammed Jaid, pill bottle with timers and reminders. Okay. It records a pill through the smart chip cap in bottle. Hmm. Pill through the smart chip cap in bottle. Hmm. Okay, makes sense. It reminder to take medications at an accurate time. So you guys are fantastic, let me tell you. Okay. Answer is correct, smart pill bottles. But why I took this question is I wanted to ask and understand from you, what is a smart pill bottle? See, everything which comes with smartness is not AI. Everything which comes with smartphone, it is not AI. Okay. Or it will not remind you everything. Understand, it will not remind you everything. Yes, I got one very relevant answer. It give only one pill every time. But again, this is half answer, Ramya. Let me tell you, what is smart pill bottles? First of all, you could have seen what I've written here. It is not a bottle, it is bottles. It is bottles. See, so there is either 7 or 30. In one box, there are either 7 bottles in one sequence. Okay. In one sequence, like let me make it very clear so you will understand it. Arey, yeah, what is this? Okay, fine. No worries, I don't mind. See, 1, 2, 3, 4, 5, 6, 7. There are 7 bottles in one row. Okay, there are 7 bottles in one box. This is for Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. This is a smart pill. This is smart pill bottles, guys. Or maybe there are 30, and on the top of the bottle or at the bottom or maybe at the side of the bottle, it will be written first, second, third, fourth, fifth, sixth, 7, 8, 9, 10, 11, 12, 13 to 30 or 31st, whatever the month is. So the patient has to look at the date and take that bottle and eat. Simple. Understand? Or if there are morning and evening, there will be 2 bottles or 3 bottles for the same day. So there is a box in that there will be for each dose, there will be the bottle that is called smart pill bottles. That is called smart pill bottles, not like the bottle with chip or bottle with AI system. Bottles cover will count the pill number, not at all. Understand or not? Smart pill bottle means you will have a sequence of the days or maybe the dates. And that will tell you or that will tell the patient about the drug utilization. About medication adherence, definitely to take the medication. It will not come and tell. The patient has to remember definitely, but it will be making it very easy, like at what time, which bottle should be taken and which drug should be taken. Understand? Smart pill bottles. Understood, guys? Yes or no? What you are talking about could be a digital bottle. Okay. What you are talking about could be a digital bottle, maybe. Okay. Yeah. So definitely television, you cannot announce on the television for taking a drug. You cannot tell the patient on television to take the drug. Not at all. You cannot even post on social media to a patient to take the drug. Maybe patient is not opening the social media day, on the same day or maybe every day or every time. Right. So not at all. Paper calendars, it will be useful. It will be useful only in certain cases, like only in certain cases when the patient is well educated. Paper calendars are also working. Okay. Paper calendars are similarly like this. Okay. But that will not tell about the date. That will not tell about the bottle. That will tell about the dates. Like, okay, first, today is the first. Patient has taken the medication. At the end of the day, patient will mark. First is done. Second is done. Third is done. Fourth is done. Five is done. Six is done. Like that, patient can mark. So paper calendars are also one of the type of tool for patient medication adherence monitoring, but not the not the major tool, or this is traditional part. This is the traditional traditional method for medication adherence monitoring. Okay, guys, got it? So smart pill bottle. I think last question maybe. Yes, maybe the last question. What is the key ethical consideration in DUE or DUR? Yes, sir, will his bottle degrade the quality of drugs as the departed from its original packages? Not exactly. These bottles are quite, when the makers claim that these bottles don't degrade the quality of the drug, so definitely, these bottles are made of, some airtight covers or something. But yeah, whenever it is coming out of the, or out of the, what we say, out of the packaging, definitely there are some harms. That there is no doubt. There are some harms, maybe 0.001%, but there is harm. Okay. A is the correct answer. A is the correct answer, definitely. What's the key ethical consideration? Patient's privacy and data confidentially. That is confidentiality. That is in any kind of research you do. That is in any kind of research you do. Ethical considerations are very, very important. Ethical considerations are very, very important. Okay. Ethical considerations are very, very important. And definitely ignoring the patient feedback is not ethical, or reducing the pharmacist workload is not ethical. Maximizing the number of prescribed drug is not ethical. Not ethical means it doesn't come under the scope of ethics. Okay. These doesn't come under, these doesn't come under the scope of ethics. Okay. So with that, I think our question answer session is, last one more question is there. What technology is most commonly used for analyzing the large databases in DUE and DUR? Paper-based records, fax machines, telephones, or what? Or ML? Yes, guys. ML. Correct. Machine learning. Machine learning is the trending thing, and we will talk on this on fourth day, definitely. Okay, so it will be going to interesting. Okay, come on, guys. Okay, done. Now let's come to the study part. What we are going to cover today, right? First, understand, I was telling the differentiation between DUE and DUR. Okay, so first let's understand DUE and DUR both. See, if I'm talking about DUE, drug utilization evaluation, guys, focus, drug utilization evaluation. This is, I mean, definitely when it comes to the definition, it is a structured criteria-based evaluation of drug use at the individual patient level. Individual patient level, okay, not at the public or, the population. Where DUR is again, it is at the population, within a population or community or a group of patients, okay. Are we gonna get the PPTs in the end? No. Recording of the class will be available for you. No PPTs. Okay. So drug utilization evaluation is at the individual level, and definitely the structured criteria based evaluation. Criteria based evaluation means there will be the entire protocol. There will be the entire protocol prepared according to what type of study we are going to do, what type of drug utilization evaluation, for what purpose, with what objectives, with what outcome we are doing it. Okay, with what objective, what methodology, what type of study, what type of outcomes we are looking for, what is our hypothesis. Based on that, we will prepare the protocol of DUE. We will prepare the protocol of DUE based on that, and then we will conduct the DUE, drug utilization evaluation, for the individual. Okay, I mean, definitely see that will be again a study, and this is not the case, guys. Focus again. Let me clarify. Let me clarify. DUE doesn't mean the individual means the case report. No, this will be a study in 100%. 100%. This can be done in 1,000%. Drug utilization evaluation can be done in 1,000 patients. But the evaluation will be done on the individual level. You have to do the evaluation for each single patient. You have to do the evaluation for each single patient. But DUR is not like that. DUR is like assessment for the community. Let me give you an example here. You should understand that. See, guys, again, focus. See, here we are planning a study of heart failure drug assessment in a group of patients, like 100 patients, 100 patient, and at individual level. Individual level means I want to check how many patients got, Ramipril, how many patients got beta blockers, how many patients got diuretics. So what I have to do is to check this. What I have to do is I have to check the individual prescription. If I have to find out like how many drug related problems, how many DRPs were there, so I have to check each and every record, then I'll find a conclusion, and I'll come to a conclusion that, okay, this was the result of this group. So this is called drug utilization evaluation, when you are going through each and every prescription, each and every patient, each and every individual. But in another aspect, DUR means you have a data of drugs used for community A. Suppose there is a hospital A. There is a hospital A, and you have to prepare the report of hospital day. Report for the hospital A, like how these drugs have been utilized. So you will say 10% drugs for heart failure, 5% drugs for cardiovascular disease, other cardiovascular disease, 15% for painkillers, 15% for pain, and 10% for the headache, 10% for this. And in that, if you go in depth, again, you will say in the heart failure, 5% were diuretics, 5% were this, 2% were this, you will tell everything. So this is called drug utilization review for a community, for a hospital, or for a group of patients. When you are doing it superficially for the entire community, you don't have the each record. You don't have to evaluate the each record, but you are going in a big data, you are doing for the population. like what type of drug things will be done here. Now I'll tell you what are the scopes and all things. You will understand it very clearly. So now look at this, the second paragraph of each. It aims to ensure that the medications are used appropriately, safely, and effectively according to established clinical guidelines. Understand? It aims to ensure that the medications are used appropriately, safely, and effectively according to the guidelines. And that only can happen when you are checking each and every patient or each and every prescription. Understand? That is evaluation. When the broader terms come for a utilization, this is definitely usually retrospective or prospective review of prescribing, dispensing, and use of pattern of drugs within a population, right? It identifies and resolves the issues related to inappropriate prescribing, potential drug interactions, and patients' non-adherence. Okay, at the community level or at a big population level, when you are checking it, like how many, like suppose you are doing a prescription interaction study. So you have a bulk data with you from a community. Okay, maybe see, at the end, that bulk data would have been come from the DUE only, from the individual patients only. But it is just the difference between the process, between the number of patient, between the number of participant, between the number of the, like between the scope of use. So scope of use for drug evaluation is individual. You have to check all individuals and make a report. And utilization review is for the public, for the community, for the population or group of people, right? Group of people. That is review at a broader term, right? And then if you look at the purpose, see, purposes are completely different. If you look, I mean, see, at the end, outcome is only one, to assess the appropriateness of drug use. Outcome for drug utilization review and drug utilization evaluation is same. That is appropriateness of the drug, appropriate use of drugs, right? So look at the DUE. It evaluates the appropriateness of specific medications for individual patients. Okay, it identifies the trend or pattern of drug use across the population. As I told you, if they are taking ramipril, if they're taking beta blocker, if they're taking diuretics, that is drug utilization review. Okay, across the population, you need to check the trend or patterns. Pattern of the drug utilization is drug utilization review. Okay, and if you're checking at the individual level for specific medications, like I want to check the utilization of beta blockers. I want to check the utilization of maybe the prils, the ACE inhibitors, like that. Okay, so I mean, different kind of studies can be fixed on DUE or DUR. Just the thing is how you are planning it for the larger thing or for the individual basis, right? So based on that, so DUE improve the patient outcomes by identifying areas of concern like underuse, overuse, or misuse by each patient, right? By each patient, if the drugs are underuse, overuse, or misuse, right? And then it supports the healthcare providers with actionable insights to enhance the prescribing practices, to enhance the good prescribing practices. When you look at the DUR, utilization review, it is like cost-effective therapy promotion, promote the cost-effective therapy by assessing high-cost medication utilization, and it detects the drug related problems such as adverse event interactions, contraindications, take corrective actions. So at the end, you are going to check the appropriateness only, but it is in the different manners, just in different manners on the individual basis or the public basis or the larger group basis. Okay, then scope. Again, the simple, you will understand it easily. Focus on individual patient involves the population level data analysis. Population level data analysis. I hope it is very clear now. I made it very clear. It is individual patient cases. It is population level data analysis. Okay. Then it targets a specific drug, therapeutic class, or disease condition. Understand, again, if you're looking for the if you're looking for what, if you're looking for the studies and all, it works on a specific drug, a specific therapeutic class, or a specific disease condition. Okay, and then it can be retrospective, reviewing past, concurrent, or prospective. It can be retrospective, past, or concurrent. And when you look at the DUR, examines the prescribing patterns, dispensing the accuracy, compliance with the formulary guidelines. That you can do with the DUE also, that doesn't matter. And assessment of therapeutic duplications, adverse event, cost variations, adherence to the regulatory norms. Okay, so it's totally different. There is nothing with real time or this. DUR also can be done. Usually DUR are retrospective. One more thing, guys. Most of the time, DUR is retrospective. Okay, not most of the time, it is retrospective. Now understand why DUR is retrospective and DUE can be prospective, retrospective, or concurrent. Because you are checking only single patient. Retrospective is, DUR is when you are assessing the entire population. So assessment of the entire population can be done only when you have the pura data, when you have the entire data of a population, when you have a entire data of the population, right? So you need retrospective data collection or retrospective evaluation. So usually DUE, another major difference between this is DUE is at individual basis and prospective, retrospective, concurrent can be, but DUR is retrospective. Okay, so historical paths, a little history about DUR. Origin of DU and DER, the concept of evaluating the drug utilization emerged in 1960 and 1970 as the healthcare system began focusing on improving medication safety, efficacy, and cost effectiveness. And it all came to the institutional framework. They made an institutional framework under WHO. Okay, so in 1975, WHO, this is not a very old concept like from the Adams space or from the some other spaces or some other eras. No, this is very new, 50-year-old, 50, 60-year-old, that's all. Okay, so institutional framework for drug utilization came in 1975 by WHO. So WHO emphasized on importance of drug utilization studies during the International Conference of Drug Utilization held in Oslo, Norway for the first time. And they created the institutional framework, means the guidelines for the proper use of drugs and how to evaluate the drug. For the first time, they talked on the drug utilization. Okay, first time they talked on the drug utilization in 1975. Okay, in the International Conference of Drug Utilization, which was held in Oslo, Norway. Okay. Then it came to, after the origin, they come up with the institutional frameworks and then they come up with the regulatory evolution. Okay. See, after institutional framework, there should be something which can review those guidelines, right? And which can overview those things or which can take control over these things, which can help in these things, right? So that is regulatory evolution. And regulatory evolution is like it came from the OBRA. Okay, so the Omnibus Budget Reconciliation Act, OBRA, in 1990 from the United States, it mandates the pharmacists to conduct DUR as a part of Medicaid program. For the first time, they did it compulsory. They made it compulsory in 1990 under the Medicaid program. So the pharmacist has to do the drug utilization review in USA. This was a significant milestone and highlighting the role of DUR in optimizing the drug therapy outcome. Okay, drug therapy outcome, regulatory, and then the last is technological advancement after 99 in 2000. In 20th century, they have, in the 21st century, they have come up with technological advancement like electronic health records and the use of AI and ML and real-time data analysis or large-scale data analysis. Okay, real-time analysis or large-scale analysis. So there is nothing much in the history of DUR, DUE. This simple 4 steps. One is origin, like when the origin happened in 1916 and 17, then they came up with the institutional framework and then they started with regulatories and it was launched for the first time in 1990 in USA. And then now the technological advancement in 21st century. Okay. So now I think today's last thing to talk about the stakeholders. That is very, very important. Guys, tell me the stakeholders in drug utilization review, guys. Yes. Tell me the stakeholders. Yes, people. Yes, guys. Stakeholders, right? The stakeholders. What are the stakeholders? Tell me. Fast, fast. Pharmacist, prescriber, doctor. Okay. Right. Everyone, please tell me what could be the stakeholders? Who could be the stakeholders in, the DUR or DUE? Tell me. Pharmacist, Pharmacists, you have to understand this is very importantly, okay? Because this is a part of this. And this will come, I'll tell you the stakeholders when you are conducting a study. When you are making the study, I'll tell you how the stakeholders will work as a collaborator. And you can collaborate, and collaborator studies have multiple importance, okay, multiple importance, and you can get grants, you can get a lot of things. All healthcare professionals, oh wow, what an answer, Ansi, what a lovely answer from Ansi. All healthcare professionals, wow, okay. If I say physiotherapists are not the part of drug evaluation, if I say the cardiology assistants are not the part of drug evaluation, if I tell that the pulmonary what we say that psychologists are, or clinical psychologists are not the part of drug utilization, I'm correct. All healthcare professional cannot be the part of drug utilization. Okay, guys, anyone else wants to say something? Okay, let me tell you. See, guys, that's you have to understand. See, first of all, healthcare professionals, only what in healthcare professionals, guys? In healthcare professionals, who? See, first, you have to understand, first and foremost thing is pharmacist. Okay, pharmacist. And then it comes to the prescriber. Prescriber, who? Prescriber. Who is the prescriber here? Prescriber is either the physician or the clinician, physician or the clinician, then maybe the nurses, I mean nurses practitioners, they are not prescribers, but they are like the people who are involved, and then physicians assistants, physicians assistant, right, physicians assistant, and then this is all about the health resource utilization from the healthcare professionals. These are the healthcare professionals which involve those are involved in healthcare resource, I mean sorry, healthcare wait, what we are talking about, drug utilization evaluation. Drug utilization evaluation. All healthcare professionals involved with activities related to medication like prescription dispensing and adherence. Physiotherapists are not, again I'll tell you. Clinical psychologists are not. They can't prescribe the medicine. The reason behind it, they can't prescribe the medication. Understand? Yeah. Okay. And pharmacists have the exclusive right to do the prescription utilization, drug utilization review. I mean, drug utilization evaluation or drug utilization review. Okay. They have the exclusive right. So the pharmacist and then the physician assistant or the physicians, clinicians, or the nurses. This is about healthcare professionals. What are the roles and how they work when I'm talking about the role? So see, pharmacist has very important role, right? They are like conducting the DUR studies. Pharmacists are known to conduct the DUR studies, and in DUR studies, they check the they monitor the drug interactions, they check for the contradictory things, contraindications in the medications, they check the adherence of the therapeutic guidelines, they check to, they get the potential medication related issues, and, furthermore, they educate the patient mainly. They educate the patient about the proper medication use and adherence strategies. So that's why pharmacist is the first and foremost part of the healthcare professionals which take care of the entire DUR process. Then prescriber, definitely they ensure the prescribing which is aligned to the evidence-based medicine. Okay, and they definitely collaborate with the pharmacist, and they are the people who take the interventions from the pharmacist, and they adjust the therapy based on the DUE result, or based on the, yeah, definitely DUE results, and based on the interventions suggested by the pharmacist. Okay, they also participate in the educational programs about the rational use of drug. They also participate in the rational use of drug. When it comes to the nurses, definitely nurses administer the medications and monitor the patients for adverse effects, right? And they are also responsible to report the drug related issues to the healthcare team, right? So one of the important partners is, and then they also participate in the patient education about medication adherence or medication administration, right? So understand, these are the major stakeholders for the DUR or DUE. Now the second thing is come here is healthcare organizations. What are the healthcare organizations? First is nothing but the hospitals and clinics. Hospitals and clinics, you know why? Because they implement they implement the DUE or DUR programs as a part of maybe the clinical governance or the quality assurance. They also provide the access. They are the major, accessors for the resources or the records or the electronic health records or the comprehensive evaluation part. They have the major records, right? So healthcare organizations like hospitals and clinics are very, very important. And then there is something called, not only the hospital, there is something called PBM. PBM is nothing but pharmacy benefit management managers. Pharmacists, pharmacy benefit managers. Pharmacy benefit managers, who are pharmacist managers, PBM, pharmacist benefit managers, they are the people who analyze the prescription claims, the data for cost saving opportunities. Pharmacy benefit managers are also the pharmacist or the people who are aware of these things. Usually the pharmacist or the medical professionals, they work on the cost saving opportunities. They work on the cost saving opportunities, and they claim the data of DUR. They use the data of DUR, they help in DUR, and based on that they claim for the cost saving opportunities. Okay, as I told you initially, they just give the data, they just take the data. Okay, and then they also help in complying with formulary guidelines and therapeutic protocols and all, right? And then the third part here is regulatory and governmental bodies. So regulatory and governmental bodies, first thing is national, like we have DCGI, or we have and the people are, I mean, US, they have FDA, and Europe, they have EMA, European Medicine Agency, right? So these people, what they do is they just monitor and enforce the compliance with the medication safety guidelines. They work on the medication safety guidelines. Yeah, CDSCO is there, DCGI and CDSCO. So they work on the, they are the national regulatory authorities. They are the national regulatory authorities. Then we have the health ministries, and public health programs are there. And then the fourth part is academic research institutions, because academic and research institutions are conducting studies to generate the evidence on drug utilization patterns. The people, the students, the faculty members from the institutions, academic research centers only work on the studies, right? They work on the studies to generate the evidence for drug utilization pattern. Okay, and they develop the tools, methodologies for DUE and DUR analysis, right? These are the people, the academicians and the students which work on these. And then the patient, definitely the data, entire data is coming from the patient, entire data is coming from the patient. So they actively participate in this process by adhering to the prescribed therapies, or by reporting the medication related problems, or by providing the feedback during the patient counseling sessions. Okay, so multiple things, multiple roles are there for the stakeholders like patient. And then the pharmaceutical industry is nothing but, they are the makers. They collaborate with the health organizations to provide the drug utilization data. They also ensure, why industries, they also ensure the proper labeling and product information for safe use. These people are the makers, right? So they tell about the proper safety or safe use of the medications, right? They also address the concerns like drug interactions or side effects which are raised during the DUE or DUR. During the DUE or DUR, the concerns which are raised, those are being taken care by pharmaceutical industry. And then definitely, we have some more, like we have some more people, in that, like professional associates. Professional associate means like, we have FIP, we have PCI in India, FIP internationally. So these people, what they do is they develop the guidelines and standards for the DU and DUR. These are not regulatory bodies. These people, develop the guidelines. We have, ASHP, American Society of Health System Pharmacists. We have International Pharmaceutical Federation, FIP. So they develop the guidelines. They provide the training programs for the healthcare professionals, and they advocate for the policies that promote the rational drug use. Okay, they promote the rational drug use, right? And then we have the technology providers. Technology providers help us in the clinical support systems, or EHR making, EHR integrations, or AI ML in the data analytics capabilities, or maybe supporting healthcare organizations in automating the DUR process. Okay, now let me tell you how these people will help you in research. See, definitely you need the patients. Okay, and you need the hospitals also, healthcare organizations, You can also try for the grant, or you can, definitely try for the grants, or you can align with the policies of regulatory and government bodies to conduct the studies, and you can report the data directly to these people. Okay, you can collaborate with them. I will come to that in, details in the upcoming classes, definitely. And then we will talk about all their roles in the research as well, how you can participate. Like if I'm talking about the pharmaceutical industry will, search for the researchers and the doctors to conduct the large studies, multi-centric studies, single-centric studies on the drug utilization evaluation, drug utilization review on their funds, right? So they provide the funds, they select for the people, they give the studies, they conduct the studies, they, you know, they do that, pharmaceutical industries, right? So you have a lot of opportunities in DUE studies and DUR studies that we can be done talk about. Okay, so with that, guys, thank you very much for today's class. This is just basics, and tomorrow we'll talk about tools and techniques. And one more thing, what I'm going to talk about tomorrow is the important part, like the importance of DUR and DUE in research, and how you can conduct the entire research protocol. I mean, conduct the entire research studies based on DUR and DUE. And from tomorrow, we'll be working on the entire part of these things. Okay, entire part of the research studies and all. So today, I hope you understood the fundamentals. Okay, wait. Oh, yes, you want the form also, right? Wait, let me share the form.